Hello, I'm so excited to see you. I'm excited to talk about AANP and just the profession of nurse practitioners, Dr. Clement. Can you introduce yourself and give us a little bit of your background?
Yeah. So I am Dr. Miranda Kliment. I'm a family nurse practitioner, and I am currently holding the position of the Region 7 Board of Director for AANP. And I guess a little bit of background about me. From an education perspective, I was a diploma grad with my RN from Bryan School of Nursing in 2004, and then got my bachelor's from Nebraska Wesleyan in 2006. I practiced as a nurse inpatient at a hospital here in Lincoln, Nebraska, mostly in a progressive care unit with cardiac patients. And then I actually moved my job from inpatient hospital to an outpatient clinic setting that was a family practice residency program in Lincoln and worked as an RN there. And that's when I decided to go back to school because I found that I really loved primary care. I enjoyed the patients that we were taking care of and found that that was a good fit for me. So I got my master's with my family nurse practitioner from Creighton in 2010 and then started working as a family nurse practitioner. I spent the first year actually at the residency program in Lincoln. And then after that, I spent a year there as an NP and then moved over to a private primary care clinic for the next 8 years. And while I was at that clinic, I went back for my DNP. And so I got my DNP from Creighton in 2016. I've been doing primary care the entire time, so almost 15 years now, I guess, as a primary care family nurse practitioner. In 2019, I moved from the previous primary care clinic to the clinic that I'm at now, which is a nurse practitioner owned family practice clinic in Lincoln, Nebraska. And so I'm excited that after we achieved full practice authority in 2015, my colleagues opened a clinic, and I am fortunate to get to work with them in an NP owned practice.
That is very exciting. And that's one thing that I think is a big topic of conversation is full practice. We are lucky enough to practice within the state of Nebraska, which does have full practice. I do know that you represent District 7. Can you tell us what district or who District 7 encompasses? Because it's quite a large area on a map.
Yeah. So as the regional director, I represent Kansas, Iowa, Nebraska, and Missouri for AANP. And so my role is to serve on the board of directors for that region.
Very good. And you talked about your practice setting, which honestly, I would love to dig into that, but I think one of the things I would like to talk more about is what drove you to get your DNP and kind of, you seem very, what's the word, excited or ex you just seem like you're ready to grab anything you can get from diploma to DNP in such a short amount of time. What drove you to get your DNP?
Yeah, I think, well, in nursing, I think there's so many different ways that we can get from point A to point B. And I was kind of a stepwise approach person. When I got my master's, I had a young son at home. I was married, and at that point, getting my master's was sort of my goal. And I wasn't really thinking about my DNP at that point. But then once you get out into practice and you start to see some of the challenges from an organizational perspective and some of the barriers that exist from a patient care perspective, you become motivated, I think, to not only care for the patient, but also to think about the healthcare system in a larger way to make changes that can impact practice more population based, right? And I was also doing a little bit of teaching. I was adjunct faculty at Creighton during that time. And so it was a really good opportunity to move forward with my DNP so that I could continue to teach as well. And in addition to practice, I teach at UNMC now at the University of Nebraska Medical Center College of Nursing. From 2019 until I guess May of 2024, I was in the family nurse practitioner program. And this last year, I've kind of focused my time and energy in the unparalleled fellowship program. And so this is a 1 year fellowship for family nurse practitioners who are working in high needs populations, right? So FQHCs, rural areas, vulnerable patients. And so I really think the DNP allows us to think about broader systems and how our healthcare system works. And while taking care of patients is part of that, I think that the DNP makes it a much more robust opportunity to improve healthcare.
I think one of the things that we'll touch on a little bit later, I don't want to stray from what we're talking about, but is the discussion of MSN versus DNP and moving forward with that. But let's kind of backtrack just a bit. I would like to speak a little bit more about AANP. Can you give a broad description of AANP and how they represent nurse practitioners?
Yeah, so AANP is our national, it's the largest national organization for nurse practitioners. And their focus is on practice, education, advocacy, research, and leadership. Their acronym is PEARL. And so those are all areas of nurse practitioner focus for AANP. And, really that professional organization is there to help support nurse practitioners, not only the NP, but the profession of NPs as well. And so I think about that because when you really delve into the things that AANP supports, they really have a broad reach, not only in just advocacy, not just in health policy, but also in research, in specialty groups, community groups that might be areas of focus that people are interested in, continuing education. It is just a large professional organization that allows us to grow as NPs.
Very good. And I know as nurses, we're told throughout our careers, involvement within our organizations, our professional organizations is key. And I do believe that even more so when you go on to a graduate degree and practicing in that advanced setting. So I'm excited that AANP has such great priorities and is so focused. One of the things I did want to just touch on with AANP and their focus right now is kind of, can you give a summary of their current policies? I know you spoke about Pearl, but can you give a little more description, maybe even go into the ICANN discussion and where that really leads to and how we can inform our nurse practitioners about those things?
Yeah, so I agree. Advocacy is huge, right? In Nebraska, we are fortunate to have full practice authority, which means that we can practice to the fullest extent of our scope and our education and training. And not all of the states are like that. And so some of the current priorities for AANP, the first is increasing access to care, right? So AANP is committed to ensuring that all patients, regardless of their location, rural, urban, wherever they're at in the US, have access to high quality nurse practitioner provided care. And they're also really focused on removing barriers to NP practice. So AANP advocates for modernizing outdated laws and regulations that limit NPs from practicing to the fullest extent. So it's their education and their clinical preparation. And really that's where the ICANN legislation comes in. ICANN legislation is just a piece of federal legislation that's introduced in both the House and the Senate that allows us to remove some of those barriers, right? It's bipartisan, it's bicameral legislation, and basically it's going to remove some of those outdated barriers like cardiac and pulmonary rehab. Nurse practitioners can supervise but can't order cardiac and pulmonary rehab, so it removes that barrier. It allows nurse practitioners to write for diabetic shoes, which seems very trivial given that we can treat all the rest of their diabetic condition, but needing the physician to sign off on diabetic shoes. So it removes that barrier. It ensures that NPs patients are represented in the attribution process for like the Medicare shared savings. And so there's many different things that ICANN encompasses, but what it will do is it's one piece of legislation that removes a lot of those barriers that might exist at a federal level from a Medicare perspective. AANP also, one of their priorities is raising awareness of nurse practitioners' role in healthcare, right? So there's national campaigns, media outreach, public education that really talk about the vital contributions of nurse practitioners in addressing healthcare gaps, right? We know like that healthcare gaps exist, and so it's an opportunity to notify and let people know that we're working towards removing those gaps. There's
Got it.
other things. Oh, go ahead, Jessica, go ahead.
No, it's just all encompassing, and that's what's so exciting about the new legislation. And one of the things I just want to point out is there's extensive resources available on the AANP website that discuss this. So if you do have questions, we can always have that available. So I just wanted to mention that.
Yes, and that's absolutely, that's excellent. There's on the website, there's information about advocacy, but then there's also the Student Center through AANP's website that is actually really excellent. And I would encourage all students to check out that student resources for AANP because there's lots of great information in there for students, especially as they're in school and then transitioning into practice. And there's also like reduced rates for membership for students and then also for that first year in practice.
That's great. And I do know, as someone who helps with students registering for their certification exams, that is a key to helping with the cost and overall preparation for those exams. So, very nice to have that student center.
The
One
one
of
thing too, Jessica, I was going to tell you is there's a really great resource in there on workforce information. So if you're a member of AANP, you can see some of the most up-to-date workforce information. AANP supports any like policies and initiatives that strengthen the NP workforce, increase preceptor availability, and enhance NP education. So those are all things that are top of mind for AANP. And then they also, have a priority of advancing research and data-driven decision making. And so I think that's really important to remember. Jessica, I apologize. Can you pause for 1 minute? I have a patient that's a hold and call.
So one of the other things I wanted to discuss is some of the recommendations that you may have for future nurse practitioner students. You mentioned the student resource page on the website. What other resources or what other priorities should students have in looking at their practice as a nurse practitioner?
Yeah, I think one of the main priorities is to be involved in your professional organizations. And involved could just be becoming a member, right? And so usually there's the state organizations and then there's the national organization. And I am an advocate to be involved in both of those, right? Because your state level is going to have things that are very pertinent to your local practice setting, where the national organization is going to have a much broader reach. And so both of them have value to them. The Nebraska Nurse Practitioner Organization is our main organization for nurse practitioners in Nebraska, but each state, Iowa, Kansas, Missouri, et cetera, have their professional organizations as well. When we are working through legislation at a state level, it's really important to know what's been done historically. And I think, if you are graduating now, you maybe didn't realize when full practice authority occurred and the trials and tribulations that occur with that. And so I think when you can be a member of your professional organization, it helps you to appreciate what's been done. And then it also helps to motivate you to move the needle forward and continue to remove barriers and allow direct access to nurse practitioner services within our state. So I am a huge advocate of being a member of both your state and your national organization. We also have lobbyists that work on our behalf, and so by being a member of your organizations, you're helping to promote the profession and making sure that we have a seat at the table when it comes to legislation. So professional organization membership, I think, is a must. I also think, as a nurse practitioner student, when you're doing your clinicals, really working with making those relationships, right? Because the nurse practitioners that you're doing clinicals with, maybe they're NPs, maybe they're physicians, maybe they're PAs, they're going to be part of your mentor network. And so getting the most out of your clinical experiences that you can, I think, is so important. Try things that are new, do things that make you maybe a little bit nervous and scared, because it's going to help to push you to be better. And so I think you really just have to work hard at finding shadowing opportunities and finding clinical experience opportunities so that you can get a well-rounded experience when you're a student as well.
That's, I think, the biggest point that you made there that I just want to emphasize is the knowledge that you're able to obtain from your organization and even just membership. It
Mhm.
doesn't even mean you have to serve on every committee or be involved in the actual legislation. It's just the knowledge of the legislation and of the process is huge in this practice. So I appreciate that conversation. I want to move on to just kind of talking about students, because the biggest concern that students have is my certification exams. And
Yeah.
one of the things that we at Clarkson offer, and I'm sure many schools offer, we do offer review. And I know that there's lots of resources out there. Are there any other resources or processes that the nurse practitioners should be looking at when they're preparing for their certification exams?
Yeah, I think certification review is so helpful. Probably the most well-known is the Fitzgerald review, and I think that they do an excellent job. I do feel like and I have no strings attached in that in that no skin in the game on that one. But they make it very easy. You know, when I graduated, it was either a live course that you went to in person, or it was basically like a volumes of CDs that you went through and you listened to on your own. And now there's a lot of different options, right? There's an on-demand, there's virtual, there's so many different ways that you can go through that certification review. But it's just such a great all-encompassing review. I think we can be confident in our nurse practitioner education, right? You finished your education, you are qualified to sit for the exam at that point in time. But I think that the certification review process just gives you a little bit of extra confidence as you're moving into that exam. I think that students can be confident knowing, okay, I have completed my education and my training and I am ready to go for that exam. But those certification reviews and then just doing questions, I think that even was similar to when I took NCLEX. I just did questions after questions, and you just get kind of used to answering those questions. And so I strongly encourage students to jump on, answer questions, use those review books just to each night kind of get in that process.
I think that's one thing that students, you can start reviewing the minute you get into your courses. And I think that's actually helpful in your didactic courses and that's the way nurse practitioner programs are set up, is that we follow and we are guided by the curriculum of your exam. Not to say that we're teaching towards the exam, we're trying to be more well-rounded, but it is a helpful tool throughout your education. So I highly encourage the reviews. I think the other thing I do wonder, and I think students also wonder, is especially in states where they have independent practice or full practice rights, is there anything that they should be doing when they're looking at places to be employed or even looking at starting up their own business? And what steps should they be looking at for that even now as students?
Yeah, I think that it's important to know your practice environment for whichever state that you're practicing in. And usually your state license, like your Board of Nursing, is going to help to direct those regulations so that you know what your kind of rules and regs and what your practice environment looks like from state to state. AANP has a practice environment map. So you've probably seen it before, but it has the red, green, and yellows on the states. And so those are places that either green has full practice authority, yellow might be mildly restricted or have some barriers, and then red are going to be the more barriers exist potentially. And all of those states have ongoing legislation, and that's exactly what AANP is helping to support, is to remove some of those outdated barriers. But I think it's important to note that it does impact where people go and where people may practice, because a full practice authority state may allow nurse practitioners to be employed in ways that they can start their own business or they can work anywhere and there's not any restrictions associated with it. And so I think it's important for individuals to consult that map and really look at their Board of Nursing and what those practice regulations are so that they know kind of where they're moving into. Now, that doesn't mean that hospitals or organizations or health systems might not have their own set of rules and regulations, but if you know your state practice environment, then that really can help you understand, okay, what's practice going to look like for me? And I think, you know, especially in individuals who are doing clinicals, they may know what it looks like in that state, but if they choose to move or they're going to be working in a different state, it's really important to educate yourself that what happens in Nebraska might be different than what happens in Missouri or what happens in California or Texas. And so just understanding that those practice environments may be different is important. And then that also should motivate the individual to be a member of their professional organization to watch those changes happen, because in all of those states, whether they're yellow or red or even green states, there's going to be legislation that's going to impact their practice. So understanding that is something that will help to empower them.
Yes, exactly. I think this has been a great conversation, and I think it's a lot to think about with our students. I do want to just go back and kind of touch out, just your experience as a student. If you could go back and talk to yourself as you're going through your graduate program, whether it was your MSN or even your DNP, what advice would you give yourself at that moment, and what would you hopefully guide yourself to do that maybe you didn't, or maybe you did and wanted to say bravo?
Yeah, I think one of the things that I wish that or that I could have done better, or I think is just really important, is to be confident in your nursing experience, right? You're working as a nurse, you know how to talk to patients, you know how to establish rapport, you know how to take a good history. You're talking to patients every single day. You know what a patient looks like when they're not well. So trusting your nursing foundation is so important. I think sometimes we are so confident, maybe as a nurse, and then we're moving into this space where we're in a more novice role and we're a little bit like, I don't know anything, and that's absolutely not the case at all. Remembering the your background, remembering your foundation as a nurse, because you have a lot of great skills already just going into your NP program. I think one of the other things that I would say is, you know, in maybe nursing, we all try to do this. We're all trying to do everything, right? Like we're going to school, we're working, we're doing all of our clinical experiences, we're potentially raising a family, and so I think making sure that you prioritize school is really important. You know, it has to be, I feel like, our number one priority when we're there, because there's a lot to learn. The NP program, whether it's the MSN or BSN to DNP program, is a robust program that requires a lot of your time and energy. And so give yourself that time, give yourself the opportunity to make school your full-time priority. It doesn't mean that you can't work while you're in NP school, but I think it's just like cut yourself a little bit of slack and let yourself be able to prioritize school, because that's going to serve you very well.
Yeah, I think one of the things that I hear the most from students is I didn't realize how much time this would take in my life. And one of the things I say when I admit students is think of this as a job. And
Mhm.
maybe it's a part-time job, but sometimes it can be full-time. So you have to really, it's not necessarily the same balance each week, even day to day. You may have more school one day versus work vice versa, but just give yourself a balance and focus on that. But remember that school is leading you to better things, so give yourself some grace.
Yeah, I totally agree with that.
Well, I appreciate you talking with me today. I those are all my questions. Is there anything I didn't ask or you feel like you want to highlight with AANP or even your experience?
No, I would just, yeah, echo the importance of being a member of your professional organizations. You know, um, advocacy can be overwhelming, and you know, learning about health policy isn't always everyone's favorite thing, but I feel like AANP does an excellent job with their advocacy center. When there's a piece of legislation that impacts NPs, they make it really easy to reach out to your congressmen and women, and it can help make it not so scary and make it a task that you're like, oh, this is kind of fun, and it makes you appreciate um, what it takes to make change in a profession. And sometimes it can be discouraging, and sometimes it can be like, oh, how did that happen so quickly? And so, but being a member of those organizations is just one of the most important things I think that we can do as part of our profession.
Yeah, I'd love to give an example. I know that one of my faculty members is helping with the Nebraska Nurse Practitioner Association and some legislation regarding that, and they've been very pleased with the help that they've received through AAMP and guidance with that legislation. Although it's a Nebraska legislation issue, they've been able to use AAMP and some of their help with previous experience in other states. So she's been very complimentary of their help. So I would say that's one of the biggest bonuses.
Awesome. I like to hear that. Thank you.
Well, thank you so much for discussing with me and having this conversation. I'm excited to share this with the students, and hopefully it'll bring about even more conversation with AANP and just practice as nurse practitioners. So thank you so much, and hopefully you have a good evening.
Thank you. Have a great day, Dr. Fitzgerald.
Thank you.